Welcome. Welcome, community friends. Thank you for participating in this coronavirus community conversation, a production of the museum's Gordon Current Science and Technology Center in collaboration with WGBH. Please take a moment to silence any of your electronic devices. And now please welcome the president of the museum, Tim Ritchie.
Welcome, everyone. Welcome, everyone, including those who are watching via the WGBH live stream. Welcome to the Museum of Science, to this community conversation about the coronavirus. I am Tim Ritchie, the museum's president, and on behalf of our staff and our board of trustees, I'd like to say that the Museum of Science is committed to be a place where this community can get trustworthy information on science and technology. We do that every day in our Gordon Current Science and Technology stage, and today's conversation is an extension of that commitment. I'd like to thank the museum's staff for pulling this event together so quickly, our panelists and moderator who are giving so generously of their time and expertise, and WGBH, our long-standing community partner and one of the world's foremost translators of science and technology. Today is International Women's Day, a day we celebrate the contributions that women have made and continue to make to our world. It is fitting on this day to remember that the world we create is the product of three things: the underlying facts that we face, the ideas we bring to those facts, and the choices we make. The facts that we face today about the coronavirus are still coming into view. We will explore those facts with our panelists. The ideas that we bring to those facts are the bedrock ideas that underlie this institution. We live in a knowable universe. We have the capacity to understand the world within us and the world around us. Science solves problems, and we can face the problems that we are facing right now. We can solve them. And this leaves us with a choice. Will we live our lives and make our decisions in light of the facts that we are facing and the science that we know? That is, are we committed to living evidence-based lives and building evidence-based communities? With these questions in mind, I'd like to turn the conversation over to our moderator, Arun Rath, the host and editor of WGBH News' All Things Considered, and to our panel of experts. Thank you.
Thank you. Thank you all for coming out here. This is a wonderful event to have all of you here for. We have some very distinguished panelists here. And I feel excited about this because not just as a journalist, but I'm someone who lives here in this area, and I have a lot of questions about this, and I have the luxury right now of being able to ask some of the smartest people available about that. And you have the luxury as well. There is an app that we're going to be using that you can get your questions to me, and I have this this tablet up here, so if you submit those questions, there's also some voting on it as well, so if there's a question that gets a lot of votes, it'll go right to the top of my list here. Pretty much from the moment I'm starting this, I'm going to be looking at your questions so we can get them involved right away. So think about what you want to ask, get them in there, and we're very excited to have you join us for this. Let me introduce our panelists right away. First off, Bhadelia. She's a medical doctor, the director of the Special Pathogens Unit, and associate professor of the section Infectious Diseases at Boston University School of Medicine and National Emerging Infectious Disease Laboratories. Thank you so much. We have with us Jennifer Lowe, Dr. Jennifer Lowe. She's the medical director of the Boston Public Health Commission. And Dr. Larry Madoff. He's the medical director of the Bureau of Infectious Disease and Laboratory Sciences at the Massachusetts Department of Public Health. Thank you all. So I want to dive right into questions about this. The one thing that I'll say about this is that I'm a journalist. This isn't a news report. This is a community forum. This is for all of us to better understand what's happening about this disease, this public health situation in our community right now. And I do have to say that one of the things that is unique about this as a public health crisis and situation is that there is a degree of misinformation and politicization which has happened, which none of us have ever seen before in a situation like this. Fortunately, I think we can cut through this by the fact that we are going to be focused on our local situation here. We don't need to get into breaking down what has gone wrong necessarily at the federal level. We want to talk about information about what's happening right now. So we might get into things that will touch upon controversial issues, but it's all going to be with an eye towards getting all of you and all of us the kind of information that we need right now, this Sunday, where we are in Greater Boston and Massachusetts with this. So first off, since we learn new things about this virus, it's incremental, literally every day. I want to start just sort of quickly running through the basics about what we know about this disease right now. And I'm going to have this open to all of you. There are overlapping areas of knowledge, but let's keep it relaxed and everybody can jump in and as you like. Remember, you have your microphones here. We'll need those from you. So first off, again, the very basics. How does this disease present itself first in an infected person? What are the symptoms you see?
So I'll get us started, and then I'm really hoping Jennifer and Larry will add to this. So what we know about this disease, majority of it now comes from both China, but other countries that are seeing sustained transmission. What we know is that this is a new virus. It is a virus that likely jumped from an animal host and is now infecting humans. And so the details, many details of the virus are still missing, but we know the basic amount, which is that in most people, it presents, even though it's not exactly like the flu, it presents with flu-like symptoms. That means that people who have it can have a fever and have a cough. In fact, those are the two main symptoms that a lot of people that have been getting sick with it in China and other places have noted, followed by body aches. You just feel a bit more run down, but majority of the people who come in have a fever.
And how long does it take when someone is infected? What's the incubation period, the period from when they're exposed to when they might show symptoms?
So the incubation period is thought to be around 4 to 5 days. I do want to add specifically about transmission that you asked about earlier. It is a respiratory virus, and so there's been a lot of confusion about the difference between respiratory and airborne. If someone has coronavirus and is in the same room but 20 feet away, am I going to get it from them? Very specifically, the respiratory virus means you have to be in close contact within 6 feet of the person who is infected.
It's not something like, I don't know, Legionnaire's disease, which would get into like the air system and circulate around. It's not live and active out there like that.
That's correct.
I'm sorry, we'll be doing the questions through the app as we go along, so we don't have microphones that we can get out. So the 6 feet is about, I guess I'm about 6 feet, so about from here to here. This I know is a crucial question. Before people are showing symptoms, can they transmit this virus? Do we know that?
So you've hit on a really important and I would say as yet unanswered question. And I think one of the things that I wanted to add to what Nahid and Jennifer have already said is that this virus we've only known about it for about 2 months now. And so the amount that we know is remarkable, but there are still so many things we don't know for sure. And I think that's one of the questions we don't yet really know the answer to. Can people transmit it before the onset of symptoms? I think Tony Fauci said this early in this outbreak, and I think it's really true. However it's spread, we know that what respiratory viruses are most spread by people who are symptomatic, that coughing and sneezing are the ways that respiratory viruses spread. And even if there are maybe occasional cases where people can spread it before they have symptoms, the important mechanisms of spread are based on symptomatic people.
And in terms of an infectious disease, we talked about the symptoms being generally flu-like, but where does this fall on the spectrum of viruses, say from like seasonal influenza to some of the newer novel SARS-like viruses that we've seen more recently?
So there are a lot of ways of comparing viruses. I mean, one of the things that this virus has in common with many viruses is its zoonotic origin, like influenzas, like SARS, like the Middle East Respiratory Syndrome, or MERS, the other two kind of major coronavirus pathogens that have caused global outbreaks. And they are RNA viruses, which means that they are quite mutable, that they can change and evolve quickly. And I think that's an important feature of many of the emerging viral pathogens that we see. There are other ways that we can compare viruses. How quickly can they spread? How transmissible are they? People talk about an R0 or R0 value, which is a measure of how many people on average will get an infection from somebody who has it. And this infection is not unlike influenza in that respect. It has an R0 of about 2, maybe 2.5. And so it's fairly transmissible. If it's greater than 1, that means that an outbreak will spread. And if it's less than 1, then it will stop spreading. It'll eventually come to an end. So we know that it's transmissible. And then I guess severity is the other thing. And again, we don't completely know the spectrum of illness with this virus yet. How many people are infected without symptoms? And that's a really important unknown at this point.
That brings us to, unfortunately, one of the first areas where there's been a bit of controversy, and that's the mortality rate with this disease. And I'm wondering if all of you can talk to what we know about the mortality rate and what the margin of error is, why there might be some confusion about it.
Yeah, I think, I've worked in many different types of health systems, ones that are really well blessed, such as ours, where we have a lot of hospitals that are equipped, and those that are not that well equipped. A lot of times we look at mortality, the idea that if a person gets infected, what are their chances of dying from that disease? And that, Jennifer and Larry will add to this, is a function of the disease itself, the virus, which we're concentrating on a lot, but it also depends on the person. What are their vulnerabilities? What other medical conditions do they have? What's their age and immune system like? But the thing that I think we sometimes miss is that it's also dependent on the health system in which they find themselves. And the reason why that's important is, well, one of the diseases, Arun, that that I've worked with in the past with patients is Ebola virus disease. And Ebola is a disease that when we saw very few people with this disease since 1976, when it was first discovered, it was thought to have a mortality of 90%. And then as we got to see more patients with it, and more patients came into contact with better health systems with this disease, we realized that with good care, even without targeted therapies, people's mortality could drop below 20%. And so what I say all of this because I think as we learn about diseases, our understanding of mortality changes, because we find out the whole gamut of the type of presentations that people have. So how many people are actually getting sick with this disease matters, and we don't yet know that number. My sense is that we will discover that the mortality rate of this disease is probably lower than what it appears to be right now in reality, but we don't yet know. Do you agree with that? Hard to comment.
Sure. It's you might think that you could just take the number of people who have died, divide it by the number of people who we've counted that have the disease, and that would be the mortality rate. But there are several problems with that. First of all, we don't know how many people have actually had the disease, because, as I say, many people may have had it asymptomatically or mildly, that we haven't even counted in that number. The other thing is that as time goes on, the people who it takes time to get the infection, to get sick with it, to go to the hospital, and to either survive or succumb. And so the time that time interval can also affect the apparent mortality rate.
I'll just add that, again, it is unknown, but one of the things that we do know is the effect of the vulnerable populations. So right now we know that older adults are more vulnerable, people with chronic medical conditions. If you look at today, at the US mortality rate, it's actually quite high, and that is unfortunate because the cluster that occurred in Washington State was in a long-term care facility where there were people who are known risk. So it looks, but of course it's just a picture in time, so we have to wait to get more information.
Yeah, and I get asked this a lot, what's the mortality of this disease compared to influenza? And I think with what we know now, it does look to be higher mortality. I mean, that's a very static number, as Larry said. We're still learning about this disease, but it does appear to be higher than influenza.
What else don't you know about this disease? I mean, what is the research, what are the data that would be most helpful to you that you don't have right now?
Well, I'll speak to one of the really important and I think unanswered questions is what does this infection do to children? Because children have been notably absent from the cases that we've counted so far. In China, less than 1% of the people who were affected by the virus were young children. And that's unusual. That would certainly be very different from flu and from many viruses. And so the question is, are children not getting this infection for some reason that we don't know? Or are they just less susceptible to the effects of it, don't get sick with it? And we've seen that with other viral illnesses also, that kids get the infection but don't show any signs of it, and it becomes apparent when their parents get it.
Because the children can be carriers, we're assuming?
Well, carriers would be one way of putting it, but really just have a mild or inapparent infection.
In comparison to flu, for instance, young children under the age of 2, definitely, certainly under the age of 5, are... Sorry, in comparison to flu, under the age of 2, definitely they're at higher risk of the mortality and morbidities related to flu. So we don't see that in coronavirus.
And again, at the other end of the age spectrum, it's individuals over the age of 60 that have the greater morbidity rates?
Yes, and it really climbs sharply with age. So, we first, with people under the age of 60, the apparent mortality is pretty low, actually. And then above the age of 60, it begins to climb, and certainly above the age of 80, it becomes pretty high. And that's what we've learned, at least from the large populations in China. And again, how that will play out in other parts of the world remains to be seen.
And then in terms of research that's needed that can help us develop some way to respond more effectively to this, the kind of things that we need the research community to continue working on, and they're already doing that, is finding quicker, rapid diagnostics, ability to diagnose patients even closer to bedside at the hospital, and of course vaccine and treatment. There currently is a randomized control trial testing one of the drugs that's NIH has already started, and it's currently at UNMC and some of the other hospitals, and as well as vaccine trials.
As far as testing goes, as of Friday when I was last on the air talking about this, I believe here in Massachusetts there were tests here, but then they would need to be sent to the CDC for confirmation. Is that still the...
Right, so early on in the outbreak, the CDC developed an assay, and testing was really only available in Atlanta through the CDC. In the last couple of weeks, that testing has been rolled out to state public health labs, and currently in Massachusetts, the state public health lab is the only place where that testing is done. That's out in Jamaica Plain. Very shortly, we hear and we hope that commercial vendors are going to have this test available. So big diagnostic laboratory companies like Quest and LabCorp are going to have that testing available, which would then be available to every clinician.
I want to talk more about testing, but as we get into talking about best approaches and practices here for ourselves and what we're doing, one thing is I know people have been asking this online and even before we gathered here. So let me just skip right to this question, and that's about public gatherings. As we sit here in a public gathering, well, obviously we haven't had any instruction from public health authorities that we shouldn't be doing this, otherwise we wouldn't be. But as people are asking here, should we be doing this? Should we be concerned about gathering together like this?
At this time, we are not we are not encouraging cancellation of large public gatherings. Otherwise, none of us would be here, as you pointed out. I think one of the issues is how are we informing our participants that come to these gatherings about basic good hygiene? And that's really the message about containment and control of this virus is, are you washing your hands? If you are sick, if any of you have a fever or cough, I think you need to leave as soon as possible. And I mean, I think that's true. Don't go to these public gatherings. Wash your hands frequently. I see many alcohol rub dispensers around the building. So it's the gathering, of course, is one of those containment measures that we can, mitigation measures that we can take if the outbreak proceeds to be more widespread. But just in terms of your day-to-day life, it's the onus is on us as individuals to really be cognizant of how we are communicating our daily germs to others that are next to us.
Yeah, and I think you might agree with this, Jennifer. That picture may change if we see more cases, more community transmission, and at that point, one of the important questions that we'll have to ask is individual to each of us, making a risk assessment. If you have medical conditions, if you're someone who might get sick and might have worse outcomes, you should do a risk assessment of whether you should go to public gatherings or not.
I'll just add one more thing. We as public health officials will make that statement if we feel that it is warranted to protect the public health.
I can actually give you sort of a real-time scenario that's happening, because as the three of you know, just as we were getting ready to come on the stage, I was getting some texts and emails that where I live, Lexington, we've had our first not confirmed but reported case. And this is actually a parent at the elementary school where my daughter goes. I'm okay being here. Nobody told me that I shouldn't come or anything like that. And the message was that we're still going to be going to school tomorrow. Things are going to be okay. But how worried should I be as a parent right now about sending my kid to school tomorrow? Or what should my concerns be?
So I guess I would say that public health takes every case seriously, and we look into every situation on as an individual basis, and try to look at the risks involved. This is a parent, not a kid, who has the illness. There's an incubation period, so if we know about a case, we identify the contacts of that case. This is something that's part of everyday public health for not just coronavirus, but for measles and salmonella and every other kind of infectious disease that we do identify cases, do contact tracing, and quarantine or isolate people is an important public health tool. And so, this person will be isolated, which is the word that we use for people who are sick, separating them from the general public so that they don't pose a risk. And then we take people who aren't sick but could come down with the illness and become contagious later. We isolate them, and we call that a quarantine. So when a person isn't sick and they're also separated, they're quarantined. And I presume that would be the case for the children, the close contacts of any given case. They would be taken out of school before they could pose a risk. And so, a school closure is most likely not necessary given that situation, given that scenario, with a lot of assumptions going into that clearly. And I would add that, schools and school systems make their own decisions about that. That's something that happens all the time.
So nice to be able to have you right here to ask you that. Let me also ask, we're getting a lot of questions about this, and it's something that my family has also been thinking about as well. We understand that we are low risk here in Massachusetts, but we're a very international place. We're a place where a lot of us travel. People are asking about, what about my summer plans? What about sending the kids to camp? What about making a trip to Europe? Should I be putting those plans on hold?
This has been an astounding time because of the rapidity at which information has been shared and the changes. I say this without joking. I'm not sure what was going to happen tomorrow, let alone summer vacation. And so, and I think that is one of the disconcerting things about this, is that people do feel a lack of control, this unknown. And so I think it behooves us as just individuals to say, you know, what do I need to make sure that my family's safe now, I'm safe, and I'm protecting the community. And for planners, that is not the greatest answer, but it just changes. It changes very quickly.
Yeah, one thing that I've seen is that some of the airlines are now allowing refunds. And so I would, if you're making plans, that's one thing to check, is to make sure that the airlines are allowing that, because I think that's a useful tool, not knowing what next week or next month might bring.
And I would just say there are very good information sources out there, and both the federal authorities, so the CDC and the State Department, have regularly issue guidance on travel and areas that are at risk and areas that aren't at risk, and try to grade that risk according to the perceived amount of infection that's going on in a given location. So those are good, reliable sources of information.
I'll ask you another specific personal one again. For instance, my young son was going to be going on a trip to Europe this summer, and we decided we don't know, not to a country that's had any reported cases, but not knowing what things are going to be like in July, the idea of him maybe being out, getting into a quarantined area, just felt like, didn't seem like a good risk. Do we make the right call? Is that something you're comfortable saying?
I bought my ticket to go abroad this summer.
Yeah.
So, but you know what? If summer vacation comes around and the situation is still at risk, I will change them.
I do want to talk more about things we can do ourselves to prepare, but Jennifer, if you can talk, all of you as well, but about, as someone who thinks about public health, obviously this is a new virus, but part of your job is to sort of be ready for the unexpected. What has been going on here across the state to get ready for a situation like this?
I'll speak specifically to Boston, and then Larry can speak to the rest of the state. So when we were aware, you know, this has been in the news, the changes in China and abroad have been in the news for quite some time. So we set up an incident command structure in late January, before any cases came to Boston or the state of Massachusetts. And what incident command means is basically the structure to identify communications, to identify resources that are needed in preparation for an outbreak or cluster or any sort of positive cases that we need to take care of in Boston. And although that sounds very, you know, it doesn't sound as important, structure is extremely important in unknown situations like this. It helps us identify communication to reduce confusion, to reduce the redundancy, and to increase efficiencies. So that was the first thing that we did. And we set it up about 3 days before we got our first case in Boston. So it really helped with communications to the public, as well as communications across our institution. I'll also just mention that we have an Office of Public Health Preparedness, and I see their table over here. This is what they do for a living. We have participated in many exercises and communications with our partners at hospitals, as well as Massachusetts Department of Public Health. We practice for this. I mean, we have what they call table talk exercises. We have monthly meetings. It's very much about coordination for what happens. So, as an example, for Boston Marathon, the Boston Marathon, we elevate our preparedness for that months before the Boston Marathon, because we know this is coming. But we also have exercises and plans for situations for the unknown, such as this.
What are some of the events coming up that you're starting to think about right now over the next several months?
The St. Patrick's Day Parade is in a couple weeks, and the Boston Marathon is in 5 or 6 weeks, so we are still in discussions with that. No final decisions have been made on any of those. And when I say no final decisions, it means that the events are still going on.
I would just back up and say that situational awareness is really important, and knowing what's happening not just in Massachusetts, but in the world. I work for an organization called ProMed, the Program for Monitoring Emerging Diseases, and their job is to provide early warnings of situations like this, and they did that in this case. Just even before the first of the year, they were announcing that this pneumonia cluster was appearing in China, And that kind of warning helps us prepare. The earlier you have those warnings, the earlier you can begin preparation for a particular situation, the better off you are, and actually the more of an impact you can have. That's a really important principle. And another aspect that I want to emphasize is that this is not the first time that the three of us have met, and they say that a crisis is a bad time to be exchanging business cards. And so having ongoing, regular communications with our international partners, our federal partners, our local partners, our healthcare facilities is part of what we do at the Massachusetts Department of Public Health. And so that's so important in being prepared for when a situation arises.
So at the healthcare facility level, one of the things that we're doing is actually, it mirrors similar to what Jennifer said, the city is doing. A lot of hospitals around you have activated their own incident command center to ensure that with new incoming information that we are getting the best strategies into place. Hospitals are making sure that clinics and emergency rooms are ready to receive, if we get a larger number of people who are sick, ready to receive a larger number of people and to provide care safely, and to train healthcare workers are trained to take care of this, but to retrain healthcare workers and give them the resources that they need to take care of patients. One concern is that if there are more cases, you may see more people who are sick requiring more medical care. So another aspect that hospitals are working on is making sure that they have surge capacity worked out in terms of how patients will get the best quality of care, even if there are more cases that come through.
Something that I know that all of you are aware of and have dealt with is that there can be certain communities, disadvantaged or disempowered communities that don't have the same healthcare outcomes, that have worse healthcare outcomes. Specifically in a case like this, dealing with an infectious disease outbreak, what are some of the things, the challenges that you face in that regard?
So I'm gonna mention this specifically. You know, one of the comments that has been made is, should we close public schools if there is a parent? And I want to point out that in Boston, I can speak for Boston, many of the youth in Boston public schools receive breakfast and lunch at the school. And so to close a school, or to close any organization that provides those services to the children, has a tremendous impact on their health and well-being. So when the decision to close a school or any organization that provides services to these vulnerable populations, we need to be really conscientious of what that impact means. So we do not make these decisions lightly, because there's repercussions. And I think that is true of any organization that serves vulnerable populations. We have been in communication with homeless shelters specifically for this. How are homeless shelters addressing this population? Long-term care facilities that serve our elder population and those with chronic medical conditions. So yeah, we do need to be prepared, because there are people who don't just get illness, can get very sick from this, and can have other risk factors, not illness, but poverty, that can be dramatically affected by this disease.
I would just add, Dr. Lowe mentioned the homeless. Our commissioner, as well as Dr. Lowe, came from the Boston Healthcare for the Homeless organization. And I know that's really foremost in her mind is equity and access to healthcare services, access to public health is really one of the pillars of our department, and really an emphasis. So it's something that we are aware of and think about every day with regard not just to this situation, but to other public health issues.
Someone is asking, and there are also variations on the same question. My question is, how do we prevent fear-mongering and racism in response to COVID-19? And there have been some cases we've heard of Asians and Asian Americans that have encountered issues. There have been people, I guess, concerned about Chinatown or things that don't quite make sense. As people who deal with public health, how do you deal with that side of it? Or first, maybe make some disclaimers about what about this disease and.
I would just say that there's a long history of this. Going back, as early as there have been outbreaks, There's been an attempt to, cast blame on certain populations, to stigmatize, to close borders, to demonize people who are often victims themselves. And it's something that I think we really have to work to avoid. And this has just been another example of that situation. It's something that we need to work hard to avoid.
Yeah, and I think it's so interesting. I think it's important to underline that we live now in an age where we're going to keep seeing new viruses develop. I think most scientists would say that we're at higher risk because we're seeing so much more change in our environment. There's a bigger population. We are putting a bigger strain on resources, and so diseases can arise anywhere. As you may remember, H1N1 that occurred in 2009, 2010, there was a big epidemic of that here in the United States, and we actually exported cases to other places. And so understanding that we're all globally linked, and this is sort of almost a Russian roulette in a way that we have to understand what the science is and act with that in mind, because the one thing, communicable diseases don't care about is they don't care about your background. They don't care about your political beliefs, And honestly, it is one of those situations where we truly are in this together, because what I do to protect myself protects you. But what I do to protect you helps keep me healthy, because it reduces the number of cases in our community. We really are in this together.
Yeah, I'll just add that it is very easy to act out of fear, and to try and say, okay, who's at risk? Who's at risk? Who's carrying that disease? Who's carrying that virus? And I think, obviously, people can look at me and say, you're an Asian American person, you have the disease, and it's out of fear, and I understand that it's a very concerning issue, but I think it is our responsibility, as you say, to really just think about how am I protecting myself, and that you give the benefit of the doubt. I mean, we are trying to all work as a community to protect each other, so to not stigmatize.
Getting a number of questions about, we had talked earlier about, say, gathering in public places, when you should keep home or keep away, but can we talk in a bit more detail about that? When should you stay home? Like cough, cold, fever? When should you keep yourself away from other people?
So, I can't emphasize that enough. I mean, we talk about community mitigation and the things that you can do at a community level to protect the whole population from illness. And, we talk about closing schools and mass gatherings, but the mitigation really starts at the level of the individual, and staying home when you're sick, staying away from other people so that you don't spread illness is just so important. And those measures that we talk about, so that you're all bored, washing your hands and covering your cough, are also just so important, not just for protecting yourself, but from protecting those around you. That's where those kind of community mitigation strategies start. And then they move into larger groups and other mechanisms of controlling things. But those individual level things. So staying home when you have a flu-like illness is so important, and it protects not only against coronavirus, but the flu and other the respiratory viral infections that are actually common.
And then, if you're staying at home, how long should you stay away from people? Till you're not having the symptoms anymore?
Again, that's one of the things that we don't know yet about coronavirus, is how long people are infectious for. So currently we're actually testing people until they test negative for the virus, but I think that's likely to change. As we learn more, we'll be able to say that the infectious period is so long, or until you're not symptomatic, plus some period of time for a margin of safety. For flu, we know for influenza that once you no longer have fever, 24 hours after that is enough time. But we don't know the answer for this virus yet.
And then if you suspect you might actually, these symptoms seem like this COVID-19, what do you do?
Call your healthcare provider. One of the advice that, being a physician to many patients who do have many medical conditions, one advice that I give them is, first, do everything you can to stay healthy. Make sure you get the flu vaccine. Make sure that you refill your medications and you take your medications, because it doesn't matter what you come into the emergency room with. If you're coming into an emergency room and there are many cases in a particular area, you're also potentially at risk because you're in a large group of people. And so keeping yourself healthy, all the things that Larry talked about, washing our hands, coughing in our elbows, cleaning the environment around us to ensure that we don't transmit the disease to others in our families, in our workplaces, and staying home. But call your provider if you're sick, particularly somebody who you are somebody who might have medical conditions.
It's an interesting question. This person writes, in Massachusetts, it is legal to penalize food service workers for calling out sick. I can't fact check that, but they ask what is being done to protect those workers in the public in case they get sick so they can comply with public health recommendations. Like, I mean, well, you could say more broadly, people might feel pressure to come into work even if they are not feeling well.
I think this is very much an equity issue, and this is what we are encouraging organizations to do, is to look at their policies, to look at their sick policies, and be cognizant of the fact that if people are sick and they have either flu-like symptoms or COVID-19 symptoms, that they stay home. We should be encouraging employers to advocate for their employees. I will say the city of Boston has revised their employee health, employee sick policy specifically because we don't want people to come to work. And so I think we can work with state legislature, we can work with we can advocate for that, but I think it really does behoove private business owners to try and be sensible about that as well.
Here's another very specific question. We've heard about protocols for washing hands. What about cleaning surfaces? What are the best way to do that? How much should we be concerned about the virus on surfaces?
So, this is a respiratory virus, so it's largely spread by coughing and sneezing, but we do know that viruses can survive on surfaces, and people touch surfaces and then touch their face and mouth and so forth. So cleaning is important. Cleaning surfaces helps. I think the focus on what exactly you clean with is probably not that important, that cleaning with household cleaner is probably a good idea for business settings, for large venues, that there are recommendations around certain types of sanitizers that are EPA approved, and actually because coronaviruses, similar to what we've talked about, actually cause colds and flus and so forth all the time, the so-called community-associated respiratory coronaviruses. EPA, there's actually an EPA standard for coronavirus that's built into some cleaning products, and we advise the use of those for the MBTA and the Science Museum and those kinds of places.
Sounds like it's just as important, if not more, to avoid that face-touching thing as much as the surfaces.
And hand washing.
Yeah, one thing I was going to say is we've given a lot of there's a lot of instructions on hand washing. One thing that we do in my medical unit, just to ensure that we have clean surfaces, is first you want to make sure you have all the areas that are busy, doorknobs, remote controls, things that multiple people touch, ensuring that those are cleaned. The second is ensuring you get enough coverage, making sure entire surfaces that you're cleaning are covered. You're not, the more of that surface area you cover, the better the chances that you're reducing that. The other is letting whatever product it is dry. It takes time for that product to kill the organism, and so ensuring that it dries out before you use it helps.
I just want to echo what you pointed out, which is to touch your face. It's not the surfaces. The surface, if the virus is on a surface and you touch it, the virus won't permeate your skin. It's the fact that you touch the surface and then touch your face. And I was telling my kids to wash their hands before they eat. I mean, that adage is really important right now. So as much as you want to rub your nose or rub your face or quickly grab the apple and stick it in your mouth, don't.
Another question here. After someone who's had a case of coronavirus recovers, are they able to catch it again, or is there a kind of a functional immunity afterwards? Or do we not know?
I don't think we know. In fact, there are only just now tests for immunity that are being developed. We are just learning about so-called serologic tests or antibody tests that measure whether somebody has had the infection are going to be very important for understanding circulation in the community and how frequent asymptomatic infection is. And those tests are really just now being developed, and there are none approved currently in the US. So we just don't know about immunity to this virus yet or how long it lasts. We can say from other coronaviruses that there probably is long-lasting immunity that's conferred by the disease, and it's one of the reasons we think that vaccines will work.
Another specific question. This is from a middle school art teacher who's older than 60 and writes that it's impossible to stay 6 feet away from students who cough, sneeze, and practice poor hygiene. I can imagine that being the case. And I can't avoid touching surfaces that students touch. Schools are open. Should I stay home?
At this time, there's no evidence of community spread. And so we, as public health officials, are doing what's called contact investigation, so to identify the person who's sick and the close contact. And therefore, if you're out in, I'll speak for Boston since I am in Boston. If you are in Boston, I think you need to be aware of your risk as a 60-year-old with medical conditions for infections in general, flu, pneumonia, whatever. So Boston Public Health Commission, public health nurses, this is what they do. We've said this before. They take into account the risk of infection to the community, to close contacts. And right now we are really speaking about the person who's sick and the person, and those close contacts of that person.
Someone writes asking, healthcare is expensive in the US. Are hospitals planning to waive fees to allow people with financial difficulties to be treated? But I guess more broadly, you know, for people who have a harder time making their co-payments and things like that, how do you address that at the public health level?
Again, it's a really important equity issue, right? We're fortunate to live in Massachusetts, where where there's really nearly universal healthcare coverage. 97% or so of the population here has some form of health insurance, which is spectacular and much higher than most of the country. That being said, there are people who fall through the cracks. And our government, at the state government level, is working to address that issue. We don't want cost to be a barrier to being tested or treated for COVID infection.
Someone writes, we've already seen the preparation or practice of remote work from tech leaders in local universities such as MIT. Should businesses and organizations start now to take steps for planning and preparing jobs that don't require an in-person presence for telecommuting?
Yes.
Simple, easy answer.
Yes, I think that's one of the social distancing measures that we're seeing is that, and it's a pretty easy one for businesses to take on. There's so much telecommuting and work from home that already happens, and to increase the ability to do that not only helps society by social distancing and reducing the spread of illnesses, but helps the company by maintaining their continuity and keeping their own employees safe.
I will also point out, the answer is yes. I think that all organizations should be aware of their preparedness plans. But I also think organizations need to be aware of the workers who can't telecommute. How are they going to be? How can we support them? I think of facilities personnel who have to come in and out, and often these are the part of the population who need that paycheck to pay their rent and to eat. And so how are organizations also supporting those people who can't necessarily telecommute, and what's the preparedness in place to address their needs as well?
And another group that's, I think, important that can't telecommute is healthcare workers. And a lot of hospitals are actually working on coming up with surge capacity plans in terms of if you have scenarios where people get exposed or get sick, how do we backfill that and ensure that people continue to get good quality of care?
Have you seen any issues with, we've heard about stores being cleared out of breathing air filter masks, hand sanitizer, things like that. Are you seeing any problems from overreactions that affect you in terms of dealing with public health?
Yeah, I'll
I'm sorry. So I think that there is an impact on access to personal protective equipment and masks. And I know that the governor announced a request for funding to increase personal protective equipment. And I'm sorry, I don't mean to speak for Massachusetts. This was at a press conference that we were both at the other day. So but I mean, I do think that there is, we're trying to prevent a stress on our resources at the healthcare level, and one of the messages about not using face masks, that is specifically so that we don't utilize face masks for situations that they are not warranted, so that there will be enough supplies for when they are warranted.
Can you talk about how there's an awful lot of things to coordinate here in terms of a public health response, because we've talked about, say, dealing with private institutions, public institutions, some are service industries, some are not. We're dealing with universities, private and public schools as well. How on earth do you manage the coordination of all of that?
Right. It is challenging, and you're right that almost every type of organization, including the general public, would like sort of guidance and specific guidance oriented towards them. We're really fortunate that our federal partners do produce a lot of guidance that's specific to different kinds of organizations, and we can't possibly mirror all of those, and so those are available. I will mention that the Department of Public Health has a great website, mass.gov/COVID-19, which has a lot of that kind of information available to different kinds of groups, specific guidance for emergency medical personnel, for healthcare workers, for schools. You can just imagine for businesses, different kinds of guidance that's out there. And of course, it changes as our awareness and knowledge changes, so we have to keep all of that up to date. So stay tuned and check reliable sources.
I'll also just add, just in reference to what Larry had said earlier, is that we are not working with people that we've never met before. Boston Public Health Commission has a long relationship with DPH as well as Boston University, BMC, and the contacts at universities, they all have maybe not my personal direct number, but the infectious disease phone number at BPHD as well as DPH. So although this seems amplified, we've been preparing for these coordination, and it is difficult, but at least we have the infrastructure already in place to make that a little bit easier.
Larry, you used the phrase a moment ago, we need to turn to reliable sources. And again, that's been something that's more challenging about this public health situation. Leaving aside for a moment the national and international scene, where do folks turn here for reliable information about best practices, what to do? I mean, once they leave here today, because things are going to change.
So I've mentioned a couple already. Certainly, the Massachusetts Department of Public Health website does have good information out there. Our Centers for Disease Control has very good information. I think even Google has become better at directing people who search online towards, initially at least in their top search results, towards reliable sources of information. I mentioned ProMed earlier, which is a good source of sort of global emerging infectious disease types of information, and reliable media outlets, reliable news outlets are also so important in getting the word out.
I'll add as well that our BPHC website, mass.gov, as well as cdc.gov, they post information and they will date and time the information that is posted. And so we are trying to provide up-to-date information, relevant information as it comes out, and so that can help you be aware of when the information is available. I'll also just to plug bphc.org, we actually have a lot of fact sheets and information in other languages, so if you know of community members who, I'm going to miss all the languages, Chinese, Portuguese, Vietnamese, Haitian Creole, Spanish, English. I think that's all of them. So that's one of the ways, how do we get the word out to our community members and those that don't speak English? There are resources for them on the website.
I lost the app. Could somebody help me get the app back up? Thank you. What is, as this disease moves forward and we're thinking about dealing with individuals who have the disease, how once someone is infected, is there treatment? Are there ways to treatments or therapies to help the person out if not cure them?
Yeah, as I mentioned, we're still working on targeted treatments, so treatments specifically against the virus itself are still, those are still things that need more development. But there actually already are steps that doctors take when someone comes in when we don't have targeted therapy. So one is we try to control the symptoms, make the person more comfortable depending on the symptoms that they're having. Two, we support the person's body as their own immune system fights this infection. We provide what we call supportive care. If their lungs if they're having trouble breathing, or if their kidneys are not working as well as they should. And third, what we're discovering is in some of the cases that were seen in some of the other countries, people may get secondary infections. So they might get a bacterial infection in their lungs while they're dealing with this pneumonia, viral pneumonia. And so we would treat them with antibiotics. So yeah, a lot of steps, but of course the targeted therapy is what we're really all looking for as well.
I just want to add, and we've touched on this a little, is that for the overwhelming majority of people who contract the COVID-19, it's a mild, self-limited illness. They don't need health care. They can take care of themselves at home like they would for a cold or flu, and will get better spontaneously. It's only if you're at high risk or you have complications or you're getting very sick from this illness that you need health care or therapy.
And Larry and Jennifer also, how does the chain of command work? Say you're a physician, you have someone in your office, they're showing all the signs. Where do you call to get the test, or like how do things work from that point?
So for most diseases, and soon to be for this disease, a clinician can order a test that they think is indicated or necessary to diagnose or treat a patient. For some of these very new emerging diseases, that kind of testing is only available, in certain ways, and so currently, as of today, that testing is only available through the state public health laboratory or through the CDC. And in that case, a clinical provider needs to contact their health department, either their local health department in the case of Boston or whatever locality they're in, or the state health department directly. And that happens all the time. Coronaviruses are reportable diseases, so like many infectious diseases, they're reportable, that required to be reported to the health department, and practitioners and hospitals and healthcare systems know how to do that.
In terms of a legal matter, as personal freedoms, is there a state at which, say I'm infected, I'm showing all the symptoms, I'm not going to quarantine myself, I'm just going to go out. At what point could the state say, no, you need to be quarantined, we're going to make sure you are?
So people are generally terrific about this and understand that they don't want to infect their friends and neighbors, and they voluntarily allow quarantine to happen or isolation to happen. In those rare instances where that doesn't happen, there are legal mechanisms that can allow the state, the local health authorities in concert with the state government to enforce quarantine.
And going above the state level, how, because as you mentioned at the outset of this, we're talking about what's happening at the local level, but this is a disease which comes from around the world. The rest of the country obviously has an impact on how we are dealing with this. How do you coordinate with the federal authorities and yeah, I mean, like, I know you've worked in international cases before, like beyond our own government even, to keep track of what you need to keep track of with this?
I would just say we talk with Boston, we talk with the local health authorities, we talk with CDC many times a day during the course of this outbreak. So this is something that we do, just regularly. It's something we do all the time anyway, dealing with routine diseases. There are reporting systems, there's regular coordination with our partners all the time, but in a sort of a ramped up situation like we're seeing here, it becomes even more so that we really do have very frequent phone calls. I can't tell you how many hours a week I spend on calls with various partners.
At the international level, the World Health Organization actually serves as the technical partner that works with many different countries to try to align best practices and to share information.
And in terms of the information out there, well, let me ask you to play media critic. You got a reporter here, you can beat up on me. What are some of the things in terms of getting the information out there that we could do better?
So the first thing I would say is that we absolutely depend on the news media in public health. We can't reach the people that the media can reach, and we really rely on partners in the media, and there are so many good ones who do a tremendous job of reporting on public health issues. Our local partners at your station and public radio in general, but the news radio stations as well, and certainly our print media. The Boston Globe has been outstanding. Stat News is an internationally recognized standard, I think, in terms of reporting on public health events. So we really need the news media, and we're glad that you are there to help us get important messages out. Of course, we don't like everything that we read, and there are sources that are not as good, and I think it's important for an informed public to be aware of that and to pay attention to reliable sources.
Yeah, I have a little bit more leeway, right? Because I'm a private citizen. I think the two things that I wish the media would do is avoid sensationalizing it, because sometimes, particularly in our world, the attention on the television or on the screen or on the computer doesn't come unless you really do these, dramatic headlines. And now is the time for moderation and really, media to be a partner to share what public health folks are saying. In a way that's even-handed and really giving the information that's needed rather than trying to make a news story out of it. And we saw that during the Ebola epidemic as well. The average person during 2014 to 2016 in the United States was not at any risk for Ebola, and that was all you saw in the news media was, the fear of Ebola. And, the second bit, I think, is it's very difficult for all of us to deal with uncertainty. And we talked about the fact that every hour there is more information that's coming out. And so I think one of the other things that media can help us, because they're so good at communicating with the general public, is how do we ensure the public that there are systems in place that are going to kick in, but at the same time become a bit more comfortable with that uncertainty, scientific uncertainty, if you will, not so much a public health uncertainty.
I appreciate a forum like this because it isn't around a specific recent press release or recent piece of information. It's really about facts, and I think to both of your points, the media and public health organizations and health organizations can really work together to get facts, information, so proactive as opposed to reactive.
I also just want to add that museums are part of that, and we're really grateful to the Science Museum. I grew up around here, and some of my happiest childhood moments were spent in this museum. Some of my childhood friends are here, actually. And I think museums really play an important educational role, and fora like this are important.
So some more kind of specific nuts and bolts questions here. And this goes to people asking about when should schools consider closing down, and also the questions about, say, boarding schools or camps that are communal living situations, which might seem to somebody, that would be a place to avoid at times like this. When do you make the call, and how do you make the call on that?
I think each of these institutions should be looking at their preparedness plans right now and thinking about the different situations that can occur, the different situations that might cause them to make that decisions. And we are very, we are happy to coordinate with those organizations. So again, I'm from Boston. We coordinate with Boston Public Schools and make decisions based on what can keep the public safe in those organizations, and I know DPH does the same. So I think it's a matter of planning. Right now, again, I'm going to reiterate, we're not advising, and public health is not advising any closures of schools. But again, when the situation changes, if the schools and institutions have those plans in place, then we can have a conversation and move towards the decision that best works for the public health as well as the health of their individual organizations.
Sorry, I just lost my place. People are asking about, we've seen in other places where there have been outbreaks, other states that are declaring states of emergency, in California, New York. What would it take here to trigger a state of emergency, and what would be useful about having a state of emergency to deal with a public health issue like this?
It wouldn't be me that would declare a state of emergency, so I would have to defer to people at higher levels of government to answer that question.
People are asking about advice about air travel. Air travel. Is that a bad situation to be in, an airplane, recirculated air, close among people?
Yeah, I mean, I think we were just having this conversation because I am getting so many messages from friends, from friends of friends, from patients about this, about travel. And one of the things that I advise them is it really is an individual risk assessment, right? How important is your trip? How long is the trip? What is your medical condition? Where are you going? And what is the transmission, where you're coming from and where you're going? And taking all of those things into account when you make that decision. As has been mentioned before, aside from the 5 countries that the CDC has identified as having category 2 or 3 risk, there really are no current recommendations for stopping travel. So it really is a decision that you and your family have to make together.
At what point is a decision made to quarantine an area, to say, this is the time to close the school, this is the time to restrict travel to an entire area?
Right. One of the things we can't do very well is predict the future. It's something that we assess all the time, every day, think about, and try to make decisions to protect the public health. As I said earlier, there are a number. There's an approach that starts with simple things that everybody can do and progresses to things like work from home policies, to limiting travel in certain ways, and that then more advanced social distancing and community mitigation measures take place. It's a conversation that we are having on an ongoing basis.
Someone asks, my husband and I both have autoimmune disorders. If one of us did get the virus, what should the other person do to safeguard themselves?
So autoimmune disorder is a condition that puts you at a high-risk category. And at this point in time, close contact, so a case is positive and will receive treatment. A close contact will be monitored daily on a regular basis by public health nurses to ensure that they have support in ensuring that they do not develop diseases, and at least get them connected to care as soon as symptoms present. And so, I think back to Naheed's earlier comment, which is do everything you can to stay healthy now. That's really the main individual treatment, is to keep healthy as much as possible.
Another cost question: if someone does have the coronavirus test, does insurance pay for it, or does the state pay for it?
So testing that's done at the state lab is free, or free to the consumer. It obviously is costly to the state, but it's free to the consumer. If and when commercial testing becomes available, it's going to be like other kinds of laboratory testing, and it's going to be between the the healthcare system and the insurer and the patient to sort of walk through that. I know that our state government is working on trying to facilitate that so that there shouldn't be a cost to people who need testing or treatment for coronavirus.
I know you've answered this question before, but we haven't specifically talked about it here. People are asking about the breathing masks, the air filter masks. Do they do any good? When should you use them?
Yeah, so the air filter masks, the N95s that you might have heard of, those are, in the healthcare setting, for example, for a healthcare worker to use that, we need to go through a testing called fit testing. We specifically need to be fitted with a type of mask, and that's when it's effective. We know we've been trained how to use it, and we've been fitted by size, and that's what makes it protective to us. The concern that, I think you might see, it's not just, the idea that we should reserve it for the healthcare setting or people who are sick or anything along those lines. But in my experience, one of the things that I've noticed is people put on the mask and their nose is outside their mask. Have you guys seen that, right? Or they lift it up and they're trying to drink from a straw from the Dunkin' Donuts coffee that they currently have. Or a lot of times you have something on your face and you reach up because it's uncomfortable and you move it around and inadvertently you're touching your face with your hands, which is exactly what you don't want to do. So I think that there are certain instances in the public setting where it might be effective, which is you are sick and you want to stay at home, but you want to try to keep others from getting sick if you are outside for a little bit of time. But in most settings, if you are not sick, you're actually increasing your chances. In my only personal experience, I have not seen data on this. People reach out and touch their faces. More likely for you to just clean your hands and make sure the surfaces you touch are clean. That helps you more.
We have someone asks about water parks, public water attractions such as pools or water parks.
I don't think any of us really know the answer to that question. Sorry.
Someone asks about if their parents are in their late 70s, if they have health issues or immune issues, does that mean that you should self-quarantine? How much should you stay out of public?
So right now, we don't think there's a substantial risk of coronavirus in the community, right? There's not, a lot of it wandering around and for someone to be exposed to. Were that to become the case, that's something that we would address, is whether people who have high-risk conditions should stay home or out of crowded places, and I think that is something that we would think about, but we're not there right now. And just to remind people that there are many contagious infectious diseases that are circulating right now that those 70-year-olds are also at risk for and need to be aware of. So I would just, put the risk in context.
People have been asking about, and this is also another area where there's been some controversy, about what the status is of finding a vaccine for this illness. But first, I think in terms of timetable, maybe you want to talk about how realistic a timetable would be for something like that?
So again, this has been an unprecedented outbreak in the sense that the pathogen has been identified, the nucleotide sequence, the genetic sequence of the virus publicized and made available. There's a vaccine manufacturer here in Massachusetts which has developed a vaccine actually based on the genetic sequence of the virus and has really already put a prototype out to what's called a phase 1 clinical trial. Vaccines and other drugs actually need to go through a series of clinical trials before they're made available on a large basis. So there's a phase 1 trial, which is just kind of initial safety testing. a phase 2 trial where the dosing and initial immune response to a vaccine is determined, and then phase 3 clinical trials where vaccines are used in a clinical setting to try to see whether they work, whether they actually prevent the disease. And what we've heard is that phase 1 trials are about to begin, but to get from the prototype of a vaccine, the bench research behind a vaccine, to actually having it in clinical use, typically is at least 18 months. And even if we really try to accelerate, it's hard to envision that being less than a year away. And that would be an optimistic scenario. There are numerous prototypes that are out there that are being pursued and are in different stages of trial. But and finally, once a vaccine gets through phase 3, it needs to be manufactured in huge numbers, right? Because this is something that the whole world is presumably at risk for. And so to get from having a product to being able to mass produce it and distribute it to millions of people is a challenge.
As for people dealing with this on the ground, the public health, right now, this is not something that's around the corner at all, that is a factor for you that you're thinking about, right? Today. Yes, today. We're coming up on the end of the time we have here, and something that I always want to ask is, are there questions about this that we didn't ask you, that I didn't ask you, that you really want to take a moment to tell people now that we have this public forum here?
I think there's, people have asked me, like, how worried should I be? How much should I prepare? And I truly think there is a reality between not preparing at all and doing crazy stuff like emptying out all the shelves from Costco and, making sure you have an entire den that feeds you for 6 months. In between probably is the reality of what we should be doing, which is I think that we need to prepare that there might be more cases. We need to prepare that our family members may get sick if there are more cases, and how are we going to take care of them if we ourselves have to quarantine or if we have people who are sick in our house. And so ensuring, again, you get your medical refills, that you have some symptom control medication around the house, that you just have enough food that if you get sick, you don't have to go to the grocery store to get more food or go to the pharmacy to get those medications. I think that's the level of preparedness that I would say is probably appropriate right now. Would you guys agree with that?
Larry, Jennifer, I want to get closing thoughts from you as well, but can I squeeze in one more specific question? We got someone is asking, can domestic animals be carriers? Say dogs or cats. Do we know?
We don't know the answer to that. Is the simple question. We think that this disease probably originated from an animal, but that species hasn't been identified. There's been one report I read about a dog that was tested positive for the virus. I don't think we think, or anybody thinks, that dogs are commonly involved in this transmission, or that that's something that we need to worry about right now.
Sorry, back to your concluding thoughts.
I wanted to point out that I think, we emphasize social isolation, avoiding gathering places. I also want to emphasize that we are humans and crave human interaction and depend on each other as a community. And I think at this stage in the game, I think we can be cognizant of our health, but also care for each other. I think if you have an elderly person that maybe not have resources, knock on the door, check up on them, see if they need something. I have mentioned vulnerable populations. There are a number of people who work in industries where they don't have sick leave, and this is very fearful for them. So if they don't get a paycheck, if they can't come to work because their business shuts down, they are nervous that they won't have food. And so I think being aware of those populations, of course we're fearful for ourselves, but we are also fearful for our neighbors, and we are a caring community. So just how do we adjust that, and how can we be helpful to others but still protect our families?
Thank you. Larry?
I think the idea that we need to be prepared, that we need to be aware of what's going on around us, that we need to maintain a certain amount of vigilance and awareness, but not panic is important. And it's very hard to modulate that, right? It's very hard to be aware, to be concerned, to hear these constant news reports and maintain a level of awareness, and also not to sort of burn out from it. There's a danger that there's a lot of hype and then we become complacent, and that's something that we want to avoid also.
So awareness, don't panic, and know your neighbors. Sounds like a good theme to end on.
Be kind to each other.
There's a good one. Thank you all so much. This has been a real treat to be able to ask you all these questions. Thank all of you. Thanks to the Museum of Science. This was terrific. Thanks very much.
And I want to thank you on behalf of the museum for your time, your expertise, and to the community. I'd like to say that we're posting all of this on MOS.com, coronavirus, and also you can find it on WGBH.com. And I'd like to thank once again our museum team, WGBH, Arun Rath, our panelists. And as you go, please know, this is going to change. Even as you walk out of this room, things will change. Tomorrow it will change. Mountains of data are going to come in. So as you go, I hope that we all will turn our minds to the facts before us, not the hysteria, to our wills to do what the evidence suggests, and then as time goes on, to our neighbors and to our community, and not just to ourselves. Thank you very much.